much for joining. My name is Sierra. I'm the CEO and founder of Elite Precision Consulting. Welcome to Global Healthcare Summit 3.0. As the owner of Elite Precision Consulting, we focus on global facilitation, meaning how you can work with teams around the world to accomplish your goals, your missions. And we wanted to have this summit to further highlight the great companies and talents in different countries around the world. Some of these countries we have done business in pretty extensively. Others, it's new to us. And we also wanted to learn more about what's happening in their region, what opportunities are there, also how they can enhance their global collaboration, what partners are they needing to bring on board to further their mission, and maybe you as an attendee, maybe you have that solution. And so we're here to talk healthcare related topics. Although our company handles multiple sectors, we really love healthcare. We've been in healthcare for 17 years and just wanted to further amplify that. So I want to introduce Eleonora. She's coming from Belgium and going to be talking to us about the great work she's doing at the European Health Parliament. We didn't get a chance yesterday to talk a lot about policies and things. And I think today is just a perfect time to kind of talk about that and how it's impacting the people, the communities. And I think this is a topic that everyone can benefit from. So thank you so much, Eleonora.
Thank you very much, Sarah, for the invitation. It's really great to be with all of you here online. Let me share my slides and tell you a bit more about what we do at the European Health Parliament. So the European Health Parliament is a movement that connects the next generation of leaders, and we come together each year, 60 young professionals, to develop policy recommendations for the consideration of the European Commission and the European Parliament. You can see below the partners. So we have founding parties, which is EU 40. This is the network of members of the European Parliament below 40 years old. The College of Europe, which is supporting us in terms of writing our policy recommendations. And when I talk about policy, I always mean legislation for the consideration of EU member states. We also have the European Patient Forum, Euronews, Johnson & Johnson, Vance, Porter Novelli, and Youth European Leadership. So these are the partners who are supporting us within this initiative. And what's special about this year, we had a very challenging topic. We all know in healthcare, we had so many things ongoing, and the task that we were assigned with was to develop recommendations for the recovering, reinventing, and reinvesting in health for the creation of a resilient European Health Union. And the topics that the European Commission selected to focus on were the digital health transition and governments. So we can see from this year's summit that the digitalization is very high on the topic. And this is exactly where we need to find solutions to help citizens across Europe and beyond. Future-proofing healthcare systems, preventive and self-care, sustainable health systems, and well-being of healthcare workers. So these are the main challenges in Europe that we need to take some concrete actions. And these 60 young professionals were divided into a group of 12 people in each committee. And then we started working on our recommendations. Now it's a lot of work that it might be a bit too much to share, but I will try to summarize what we have got here. And of course, you can visit our website to find out more in details what are these challenges and recommendations you can apply into your regional, local, or national level. So for the Digital Health Transition and Governance Committee, I think the biggest issue we had to ensure was how to increase digital literacy in European citizens. And this has to do with a lifelong learning, and which means that we healthcare professionals need to be trained with the right skills to use these digital tools and to also create trust and awareness. We have the GDPR, as you know, which is creating a lot of trust and a lot of conflict in terms of sharing health data. So it's very important to increase the trust that we have. Next, we have the unlocking of potential data sharing, and this has to do practically with the interoperability of the data, of the infrastructure that we have, and the governance framework. So before we start using these digital tools, it's very important to create the framework so it's safe and people can benefit from it. And last but not least, it's also about the regulatory pathways. We all know about HTA, the reimbursement of such tools, and also increasing funding opportunities for digital health entrepreneurs, because of course, this is also one of the biggest challenges we have, not only Europe, but globally. Up next, we have future-proofing healthcare systems. I feel like with the COVID-19 pandemic, we saw that health has no borders. So it's very important to have this kind of collaboration that we're doing even here today to share information, best practices, so we can all benefit. And this is how we can create resilience. So at the EU level, the European Commission suggested the creation of a new agency, which is the Health Emergency Response and Preparedness Authority. It's similar, such as the US BARDA. So we're also trying to learn some lessons and see what's done at other places to improve. The European Action Plan for Resilience of the Workforce System and mental health. I think this is also one of the biggest challenges we have in Europe. Mental health is at its stakes. It's something that was a lot of stigmatized, but now people openly speak about it. And also for the healthcare workforce, we see a lot of healthcare workers leaving the field, moving for better payment, recognition. They've been suffering. We've been all applauding in our balconies, I would say, during the COVID-19 pandemic, but it's also very important to now recognize and reward these people who are keeping us safe during these difficult times and beyond. Up next, it's also about placing patients first and boosting innovation. And this has to do with establishing an EU task force for hospital management, thinking about social innovation for health, adapting to pathways of medicine of the future, and timely access at the payer level. So accessibility is also a big issue. And last but not least, we were thinking also about how to strengthen healthcare in Europe. This is quite ambitious, I would say. We haven't seen this working because, of course, we have the sovereignty of the countries and wanting to keep national policies at the local level, especially we see that, for example, in France and Germany, which are more financially strong, they prefer to take these policies, excuse me, at the national level. Whereas smaller countries, they of course would like to see what the EU level has to offer and suggest and move on. So it's also important to draw a thin line between recommending something and actually making it implemented at reality. Up next, we have preventive and self-care, which is very important. One of the things that we thought we should focus more were non-communicable diseases. This is also has to do about healthy lifestyles, expanding the European Center for Disease Prevention and Control mandate so we can tackle better future pandemics or whatever is up to come. And then we also have to think about healthy diets such as nutrition, smoking, alcohol control, and physical activity. Because during the COVID pandemic, we also saw that by staying at home, patients were not moving a lot, which deteriorated the process of recovering faster. And it's also important to tackle issues such as obesity we see in children and such as having a healthier lifestyle and not just, in the fast forward way that we are living nowadays. It's very important to take care of ourselves as well. And we can do this by creating some digital tools. So we can see that we can raise awareness about healthy lifestyles with digital apps. And also through education. Education is very key. From a younger age, children should be taught about how to afford this kind of healthy lifestyles, which is not done right now at many EU member states at the level that I wish we would like to. And then it's all about upskilling the healthcare workforce. So because they are the teachers, they're the one educating the patients of how to do this. So it's also, again, putting education and regular checkups because we suggested to have paid leaves for people who want to do some checkups because it's sometimes very hard for people to take some day off at work at the expense of the employer to go to do some checkups. And this is something that we need to put prevention at the center of what we do rather than cure. Up next, we have sustainable health systems. And this is something that I really like to see, that what we were aiming was achieving an economically fair, environmentally neutral, and socially inclusive healthcare system. So we have seen in Europe, from wildfires at the south of Europe to extreme flooding in the central Europe, climate change is here to stay. And of course, it's all about how we can ensure that we have a zero imprint when it comes to pollution. So this is why we thought it's good to revise the European guidelines on correcting, implementing participatory spaces like on budgeting, including pharmacists and community workers in dealing with minor illnesses. So putting them at the front line, and then patients don't have to go to hospitals for minor checkups, establishing a European health literacy awareness plan, and then making sure that the pharmaceutical sector is environmentally neutral in terms of how they produce the medicines, taking into consideration also water pollution and also ensuring that there's no medical waste. And last but not least, to think as hospital as a whole when it comes to their emissions, to move towards net zero and use data and interventions to ensure that there's, when it comes to supply chains emissions, that they minimize the impact. And last but not least, we had the well-being of healthcare workers committee. I was also a member of this one. It's we focused a lot on mental health and the well-being of healthcare workforce, which is very important. If we want to think about patients, we need to think about workers as well. So we were talking about the creation of establishing well-being helplines so that healthcare workers, nurses, doctors, pharmacists can walk in the hospital. And especially during the COVID pandemic, it was important that they could also speak about the challenges that they faced, because since a lot of relatives and family members could not be admitted at the hospital, a lot of the bad news, let's say, was break from the phone. And this created this kind of emotional challenge as well, not only the physical one. So it's important to look at health, not only physically, but also mentally. And then we also talk about healthy food when it comes to hospitals. I think this is also quite rare to see that, because if you visit any hospital around Europe and beyond, you see there's not the most healthier choices, but rather the fastest choice that you can find, or even the quality of the food that they serve in the hospital is not the optimal. So we can also improve this. And then creating this kind of cultural transformation, we would say. It's all about being able to go to your manager and speak up when something doesn't feel right, nice and good for you. Focusing on soft skills, again, for helping when it comes to mental health. Creating a work-life balance, which is very important. And this is where we were successful, actually, in this edition. We drafted the new rules of the work-life balance directive. These were some of our suggestions, and we had the recognition of informal carers, which is very important, as from now they were not. And this gives us the flexible hours working for caregivers, so they can have this kind of benefit. It also recognizes about parental and maternal leave, so parents can, dads as well, take leave when it comes, and it gives more flexibility in terms of people who help each other. So this is very great to see finally coming into a reality. And again, the recognition of unpaid carers and the rise, this is also something that we are successful. And last, we were thinking about the thematic networks. The European Commission has the EU Health Policy Platform, where they have different networks of stakeholders working on specific topics. And we think that the mental health should be also a thematic network, which is picked up right now as we speak. And last but not least, we were talking about the creation of a European evidence-based well-being knowledge hub. This is actually a platform where people can share best practices about how they support mental health for themselves, but also for patients. So that's it. I was trying to go through everything to make sure that we have covered as much as I could with the limited time. Of course, you are more than welcome to visit our website and find out more. Feel free to also connect with me via LinkedIn. Peter Sierra is also here, and I'll be very happy to answer to any questions.